for the girls. So they go where the girls are. So they go to malls, they go to parks. And again, a lot of these girls are troubled. So they go to juvenile detention centers. They go to the residential facilities where the girls may have been placed, such as group homes, foster homes, shelters, and courts. And the worst thing they do is they buy girls. They will buy girls from other traffickers. We have had victims tell us that they have been sold to traffickers by their own siblings. They have been sold by friends, their boyfriends, or what they do is the internet. These girls are on chat rooms, they're on playing video games, and the traffickers make believe that they are other girls or they're playing video games. They strike up conversations. Next thing they say, let's meet. And they meet and they actually kidnap these girls, they drug the girls, they beat the girls, and next thing you know, these girls are now being trafficked. So the way a trafficker works is they find the vulnerable girl, and then the next stage is what's called grooming, or commonly called finesse pimping. So she's vulnerable, she's been neglected, she's been abused, and now what he does is he pays attention to her. He pays her compliments, he tells her she's beautiful, she's wonderful, she's sweet, she's kind. He promises her a future, a better life. And they buy them gifts, and then they have to become sexually intimate with the girl, because remember, the next phase is she has to go out on the street and have sex. And then what happens is there's this bond. She trusts him, she's bonded to him, she believes him. And then at some point he says to her, we don't have any more money to live. Can you go out and just have sex this one time to support us? And if she agrees, then that's the perfect finesse pimping. If she doesn't agree, he moves into guerrilla pimping. And this is where the beatings start, and it's brutal. Girls have told me they've been kicked, they've been punched, they've been hit with cords, they've been thrown downstairs, they've been pistol whipped. They get raped, or they watch other girls get raped. And basically then, once they submit, they're turned out on the street. And then they basically have sex for money. There's also now the element of psychological abuse. The days of you're beautiful, you're wonderful are over. You are now his property. You are threatened with physical violence. You are told from now on, no one will want you, no one will help you. This is the best life you're going to have. And they're basically taught to fear authority and police. They're told that if you are told, if you go and tell the police that you're doing sex for money, you're going to get arrested, you're going to, I don't know what it's doing. Okay. If you tell the police, you'll get arrested for prostitution. Now, in Missouri, if you are under the age of 18 and someone is having sex with you for money, you will not be arrested for prostitution. You are considered a rape victim. So the traffickers are lying to these girls. So it is all just psychological abuse. The other thing they do is they move them from place to place. They put them in a house and they move them and move them and move them. They take all their identity, all their ID, they tattoo them, and I'll show you the tattoos, with the pimp's name or the pimp crown. They even sometimes rename the girls. So in other words, what they're doing is they're taking their identity, they're giving them a new identity, they're isolating them. They're making these girls feel completely powerless, like they have no alternative. I mean, it's just a whole form of psychological abuse and beating them down so that they feel completely powerless and isolated. Even if these girls run away, they often run back to the trafficker because they feel like they have nothing and no alternative. So the question always comes up, could you recognize a trafficking victim? And as healthcare providers, as parents, as members of a community, could we recognize trafficking victims? And I have slides that basically tell parents, you know, if you saw a change in your child's personality, if your child came home with a tattoo, would you recognize your child with failing grades, missing school? Would you know that your child's being trafficked? As a teacher, would you recognize one of your students as being trafficked? As a member of a community, if you saw a house suddenly with video cameras and, you know, pit bulls, would you recognize that house as a trafficking house? And as healthcare providers, could you recognize a trafficking victim? And I think one of the things when I give these lectures to train healthcare providers, they actually look at me and say, oh, no, we don't see trafficking victims. And I want to say to them is, no, you actually have trafficking victims. You're just not looking for your trafficking victims. 88% of all female and adolescent sex trafficking victims actually seek medical attention, and they seek medical attention more than once. And if you have an emergency room at your medical center, which we all do, your trafficking victims are there. If there's an urgent care affiliated with your hospital, or if there's an urgent care or a Planned Parenthood in your community, you have trafficking victims. So they're there. The key is, though, we have to recognize them because they don't raise their hand and say, hello, I'm a trafficking victim. It's up to us to recognize them and to reach out to them. Now, I'll give you a couple of hints to recognize them. And one of the first things is the presentation and the demeanor. They do not come in alone. They come in with an escort. And that escort is going to be the trafficker, the bottom bitch, or another victim. Because they're not going to come in alone, because what they're afraid of is they might disclose. So the trafficker comes in, and the bottom bitch is a former victim who now is a woman who's in control of the girls, and she is more vicious than even the trafficker. And what you'll notice is when she comes in or he comes in, they are in control of the interview. They do not let the patient talk and tell you the chief complaint. And she will she will control the whole interview. She will give the history. She will give the complaint. She will not be forthcoming, or he will not be forthcoming in the medical history. And when you try to ask questions, he or she will shut you down. She will not tell you who her doctor is. She'll not tell you the medication. And it's like if you've ever interviewed a child abuse victim or you've ever interviewed a domestic violence, you're not getting the whole history, and you know it. And it is very deliberate and controlling. And the victim or the patient does not make eye contact with the person giving the history. The victim doesn't make eye contact with you. They're submissive. Their head is down the whole time. She has the patient's ID. You know, if you ask for the insurance card, well, there is none. If you ask for a driver's license, there is none. She's given the address. She's in control of the whole interview. She won't leave the room. You try to examine her, she's not leaving the room. She's in control, or he's in control the whole time. And there is a complete disconnect when you go to examine the patient between the history and the complaint. So most of the times the complaints will be GYN related because of the profession. But when you examine the girl, and if she's coming in for a vaginal discharge, the girl doesn't have just vaginal discharge. This girl comes in with florid PID. Or if she comes in for, let's say, vaginal discharge, suddenly this girl's got a labial abscess and she's got herpes and PID. If she comes in for, let's say, a laceration, and she said, I was washing dishes, suddenly she looks like she's got a box cutter injury. Or if she came in with an assault, it looks like she went 10 rounds with Mike Tyson. So there's a complete disconnect between the history they're providing you and her physical exam. And then there's some very unique things that these girls will come in with. I'm going to show you the pictures of the tattoos, but hotel keys. These girls come in with multiple hotel keys and cell phones. Every kid on the block has a cell phone. These girls have multiple cell phones because the way they work is they put advertisements in newspapers, but each advertisement has a separate cell phone number. So they have multiple cell phones. That's how they get contacted. And then their cell phones ring continuously in the room because that's how they work. And these are the tattoos they have. These girls, most girls who have tattoos, they're pretty. They're butterflies and they're flowers or they're dates, things like that, barcodes. I mean, they have barcodes on their neck. The dollar sign, that's classic of a trafficking victim. And these girls have tattoos on their necks, their breasts, their upper inner thighs, their genitalia. These are not places where most girls put their tattoos. Property of, so they'll have tattoos of traffickers' names, but the names are like stick and stump. They're not names that you would normally see. Mookie. I had one girl with Mookie tattooed across her breasts. The crown. The crown is the sign of a pimp. Genitalia. I don't know any girl that tattoos her labia, tattoos her mons pubis. Again, this is what traffickers do to these girls. Sometimes you'll see the gangs have the insignias tattooed on the girls, because now the gangs are into trafficking. All right? So again, the next question is, if you do have a victim who comes in, what do you do? So the program that we've developed over at Cardinal Glennon, when we have a victim, we only have our social workers interview our victims. And we work with the St. Louis Metropolitan Police Department, that's the city police. And our social workers are all trained by the police department. And they have given us a formal script that we follow to interview the girls. And the reason these questions, nowhere does the question say, are you being trafficked? So we follow a script, and if you look at the questions, it's interesting. It says, it's like a simple question says, do you choose when to sleep? Because it's an interesting question, because the girls will actually answer this question. And for all of us, do you choose when to sleep? Automatically we'll say, of course we choose when to sleep. These girls actually will say no. And when you say no, we automatically know you are being controlled. And that already is a red flag for us. It may not be you're being trafficked, but you're obviously in a dangerous situation. It might be that you have a controlling boyfriend. It might be domestic violence. And as you go through all these questions, we get more and more information. How do you earn money? Do you get to keep all the money you earn? They're going to say no. We know that you're either in, again, a controlling situation or a trafficking situation. And as the questions go on, have you ever done anything you didn't want to do to get food, clothing, drugs, a place to sleep? We know that you're in a dangerous situation. And as the questions escalate, the social workers are getting more and more information, and we're then figuring out where to go. The one thing you have to do, though, is you've got to separate the victim from the trafficker, and that can get a little hinky in our ER. And so what we tend to do is we say to the girl, oh, we can't do your X-ray, we can't do the test till we get a urine. And what the nurse does is she takes her to the bathroom, and our social worker is actually sitting in the bathroom and is interviewing her in the bathroom. Or we have to take you to X-ray. She goes into X-ray, and our social worker is sitting in X-ray. So we've already plotted this all out. We've trained all our nurses, and we find ways to separate the trafficker from the victim. And we also have security. If we think we know we have a trafficking situation, we already have security on alert that we've got a bad situation. Do they disclose? A lot of times they don't. They're afraid that they're going to get killed. They've been brainwashed, they're going to go to jail, so they don't disclose. They're ashamed or guilty. And some of them actually don't see themselves as a victim yet. You've got years of, months and months of this brainwashing. We thank them for speaking to us, and we offer them services, and we tell them, come back. If anything happens, come back, because we have 24/7 social work. If they disclose, they are children. They're under the age of 18, and in Missouri, they are victims, and they are regarded as sexual assault victims. And in Missouri, a pediatrician, or any physician, can take protective custody of a child who's being sexually assaulted. So we can actually take that child, and we do. We remove her to another room, security guards her, we take custody of her, we call law enforcement, we call local law enforcement, and then we call the sex trafficking unit, and that's the end of it. Now, we could care less what the trafficker does. He can walk out of the ER, but we take custody of her. And at that point, I respond to the ER, and then I take medical control of her. And then we do a complete intensive medical history and exam. We do a medical health assessment. We go through her drug use. We do an assault and injury history because, like I said, these girls have been beaten, and they have not gotten any medical care for that. We do a very good sexual history. We test for all kinds of sexually transmitted diseases, hepatitis B and C, HIV, syphilis, pregnancy testing, drug history, and we do a forensic assault kit, especially if it's been 72 hours, because we do want to get DNA because these traffickers are continuing to have sex with these girls. We treat for chlamydia, gonorrhea, and trichomonas empirically. We do HIV, we do the 28-day prophylaxis for HIV if it's been 72 hours. We do, if it's been within 5 days, we will do ELA for prophylaxis against pregnancy. We arrange for them to be placed in a safe house, and then we see them 6 weeks, 3 months, and 6 months for follow-up. The other thing that we do is, with my program, we work with the St. Louis Metropolitan Police Department Intelligence Unit, and that is the unit that literally goes out on the street looking for adolescent sex trafficking victims. They work with schools, they work with the adolescent unit for runaways. They literally just comb the streets looking for girls who they think are sex trafficking victims. They go out there and they try to convince the girls to come in off the street. And boys, unfortunately, most boys will not self-identify, so we get the girls to come in off the streets, the boys will not come in. If these girls will come in, they are brought to Cardinal Glennon, which is where I work, and then I'm on call for the police, and then I will respond to the ER and do the medical assessment for the police department. Barriers to success, we need more training and education, not just for obviously medical personnel, but we need to get the word out to schools and communities. We need more safe housing to take care of these kids. There are legal issues. Some of these kids are involved in criminal activities. The traffickers are dealing drugs, and they're using these girls to sell drugs. So a lot of these girls, they're not going to be charged for prostitution, but they do have other crimes that they're involved in that they have to be released from. We had one girl who was actually involved in a plot to kill 2 police officers. So, you know, these girls have drug charges and other charges against them that we have to deal with. And even once we get them into rehabilitation programs, they're behind in school. They need, you know, psychological counseling, job training. So there are other barriers to these girls that we have to combat. Does anybody have any questions? Yes, sir.
So, what's the long-term outcomes of the? So they're psychologically scarred for probably for life. But so you remove them from their environment. How successful are you in keeping them from going back to their?
I mean, so there are a couple of programs. One of the programs we work with is Covering House, which their program is very unique and is better than most because they take the girls in for a year. And they do intense psychotherapy, education, job training, and that's really the best program for them. Because if you try to put these girls in like a 28-day program, that's useless. Because what happens, we know from the shorter programs, is those girls go and they run right back. So the Covering House program has had some success, but this has only been going on for 3 or 4 years. So we're going to have to wait to see the long term. But the best programs are the programs that go on for a year, because these girls have PTSD. These girls have depression. These girls have anxiety. Because don't forget, a lot of them are already coming from abusive backgrounds. So they've got the baggage of being sexually and physically abused already. Now you add being trafficked on top of it. So they do run. I mean, we've had girls that the police pick up off the street, and they run right away. So it's a long-term thing.
So bringing them back home doesn't?
No, it doesn't work. They've tried to put the girls in the home, and even some of the girls do have loving homes, but if you put them in the home, the trafficker will go to the home and get them. If you put them in the school, the trafficker will go back to the school and get them. They really need to be in almost a locked-down program, away from the trafficker. I mean, there is a reason they're called predators. Any questions? Yes, ma'am.
What about boys?
So boys are much harder to deal with because girls are much more willing to what we call self-identify. They will come out of the shadows. In St. Louis, there are groups that specifically go out for the LGBTQ community and for boys, but boys are much harder to get to come forward. Girls, it's just more socially acceptable for a girl to say, hello, I'm a victim. It's much harder to get a boy to come forward and say, I'm a victim. Like I said, we do have groups that specifically go out on the street looking for boys. We have yet to have a boy. I have not worked with a male victim yet. All my victims have been girls. They are much more responsive and receptive. Yes, ma'am.
What were the obstacles in setting up the program that you had? And is it something you think that can be expanded to more
I would love to bring,
emergency departments?
well, there's two things I've noticed, is that when I first started talking about this, I literally got this, oh, we don't have that here. I mean, that doesn't happen here. The second thing I got was, oh, you mean all those little Russian girls that come from Russia? People think it's all people being brought into America. They don't believe it's happening to American girls. And the other thing I think is people don't, I just don't think people understand that they blame the victim. There's a lot of victim blaming. Well, why doesn't she run away? They don't understand that a lot of these girls are high risk, and it's this psychological torture that these girls get in, and then they get trapped. I mean, I think people have to accept the fact that these girls are young, they're starting out at 12, they literally are sort of this brainwashing. I said it's a combination of domestic violence and sexual abuse. They don't think they can get out. And it's not like you're a 30-year-old woman where you can get an apartment and get a job. She's 12, 13, 14 years old. Some of them have been thrown out of their home. Where are they going to go? And they have nowhere to go. They have no opportunity, no education, and they've been abused. So I think we have to get to the sense that this is actually happening in the community. These girls have no opportunity of anywhere else to go. They've been abused, they've been neglected. And I think, people have to accept the fact that this is actually happening. Yes?
Do you find that some of the HIPAA laws are preventative in proceeding with the MD examination?
Well, with child protection, HIPAA doesn't really impact us that much, because if she becomes, when you do like child protection, we kind of can bypass that, because in other words, when I take protective custody of her and then Children's Division gets involved, we're allowed to exchange information with law enforcement as long as she's in protective custody. So then I can exchange information with the prosecutor, with law enforcement, as long as she's in protective custody. I can sort of bypass that, especially if she comes into protective custody.
Is that only in Missouri, or is that really nationwide?
Pretty much that's nationwide. As long as she's in protective custody, you can exchange information that way. But it depends on your age. In Missouri, age of consent is actually up to the age of 18. You have to know what your different, I think New York is 17, but you have to know what your different laws are and where your prostitution laws are in all the different states. But you have to be familiar with all your different. Missouri is very good that way about protecting your children. But you have to know your laws. Yes?
Do the traffickers retaliate against you or your program?
No, they have not come after us at all. Not yet, anyway. I'm leaving, so they're going to have to find me. They have not come after us. It's funny, we've had a couple in the ER, and they just kind of walk out. But we do have video cameras in our ER. We've had the police come in and tell us where to position our cameras, too. And we have metal detectors now, so that when they register, because they're smart. They're stupid and smart, because they don't, you have to ID everybody now, but they're smart enough now to know, they do the thing with the caps. If you put a baseball cap on, that's why people wear sweats and caps, because it's the facial ID. So they'll do the caps and stuff when they come in, but we have video cameras as you go out of the hospital, and they don't realize that. So we catch them sometimes leaving the hospital, and so we've ID people leaving the hospital. And we have the cops help us do that, to ID people as they leave the hospital, but yeah, so.
Last
Yes.
question?
Yes. Yeah.
the two programs unique, or can you do it internationally?
Well, see, that's the thing. One of the problems, we work with the St. Louis Metropolitan Police Department. St. Louis is kind of crazy with our police department. So we have city cops and then we have county cops. And it's interesting, that's what I wanted to talk about, is our program's unique in that the police pick the girls up. So we have the girls who walk into the ER, and then we have the cops literally trolling the streets looking for victims. So the city cops, if they find girls, they literally pick them up, bring them to the ER, and then they get placed. And that's very unique about our program. A lot of what police will do is find victims and place them. And medical care comes after the fact. And that's what's very unique about our program. And that's what I want to bring to New York when I move back here, is because we found that if you pick these girls up, they all have sexually transmitted diseases. And the medical care is being pushed aside, because almost 100% of the girls that I see in the ER acutely have gonorrhea, chlamydia, trichomonas, HIV, herpes, HPV, and Hep C. The only thing I have not seen is syphilis, but I have seen everything else, including pregnancies. I have seen everything except syphilis in my ER, and I'm talking girls as young as 12 with diseases. And they've also had these diseases before. And what's happening is, and you'll see a lot of these shelters are placing these victims, and yet medical care is put on the back burner. It's after the fact. And what we do in St. Louis in my program is, no, you come from the street to the hospital and then placement. We are treating them like true rape victims. This is your medical care first. We focus on medical care first, and then you get placed, and then we follow them up, like the CDC recommendation for a rape victim. We see them in 6 weeks, 3 months, and 6 months. We are drilling into these girls, you are a rape victim. And it's like, we're going to do healthcare, and we drill that into these girls. You're a victim, and and this is how we treat them. And that's what we do. And that's very unique. Now, the county cops, we're trying to brainwash them into doing that. That's not how the county cops do it. The county cops do it a different way. The city cops do it our way. And so we're a city hospital. We're not in the county, we're in the city. So we've worked very closely for years with the city cops, and that's how we work with the city cops.
Question.
Yeah.
When the girls are placed after their medical treatment,
Yeah.
what mechanism, if any, is used to keep them in treatment for a year? For example, if there's some criminal activity, are they remanded by the courts that you have to stay in this program for a year? What is done to keep them, since they've been brainwashed, from running back to the pen?
Well, that's the problem. Some of the programs are for a year, and some of them are not. And so some of them are remanded by court, and some aren't, so that can be a problem. And so the Covering House program is a year, but it's not always remanded by court. Sometimes they actually have good families. Some of them do have actually loving parents who sign them into the program. Some actually are in state custody that can force them into programs. Some of them are in juvenile, sort of a detention situation that we can remand them into programs. And some are just not in the really good programs, and they get out and run away. So it's sort of not a perfect system. The goal would basically we have a new program called Annie Malone that actually is just opening up a program too. They just opened up 12 beds that is going to do a long-term therapy. So it depends which program they get into. But the goal would be for all these girls to be in a program for a year.
And I just have one
Yeah.
other question about HIV.
Yeah.
In New York, we have contact tracing and partner notification. So when you find somebody who's infected with HIV, is there any follow-up to try and find who the Johns were, so that they don't keep, so that they can be tested to see if they're positive?
I don't know. I know is that if they're positive, we have to report it to our Board of Health, our version of Missouri. We don't call it Board of Health, we call it Missouri Health Arts or something. Healing Arts. We report it to Missouri Healing Arts. I don't know if they ever find these guys. I mean, you know, I guess they could report it to a trafficker, and maybe he could help find, you know, call all those phone numbers and Backpage. I don't know. Too bad, so sad.
Thank you.
You're